I now warmly welcome Dr. Sarath Samarage, Senior Fellow, Institute for the Health Policy, Sri Lanka, Consultant Community Physician, former National Consultant for the World Health Organization for Sri Lanka, to deliver the keynote address.
A very good morning, distinguished invitees, guests, Dr. Nihal De Silva, Chairman, IIHS, friend Dr. Kitsiri, the CEO, dear participants. I am indeed honored and privileged to deliver the keynote address. At the outset, let me congratulate IIHS for selecting this theme, very timely and appropriate theme for your bioinquiry conference. I am indeed very much honored and privileged to deliver the keynote address on this theme. I'll be covering briefly broadly about the general process and the features of SDGs, then moving on to the health in SDGs, that is the theme that we are talking about, health and well-being. Under that, the health goals and its link with the other sustainable development goals and the targets and health targets in the other goals, as well as the global monitoring framework. And also I will be touching on potential priority action areas, what we need to do in terms of health and wellness and sustainable development goals. At the United Nations Sustainable Development Summit on 25th September 2015, world leaders adopted the 2030 Agenda for Sustainable Development, which includes a set of 17 Sustainable Development Goals. To monitor the progress of these 17 goals, 169 targets have been identified, and they are to be achieved by 2030. This momentous agenda, which came into effect on the 1st of January 2016, will serve as the launchpad for action by the international community and the national governments to promote shared prosperity and well-being for all over the next 15 years. What are the Sustainable Development Goals? Already you had a glimpse of them. The 17 Sustainable Development Goals and the related 169 targets are expected to stimulate action over the next 15 years in the following areas of critical importance for humanity and the planet: no poverty, zero hunger, good health and well-being, that's our theme, quality education, gender equality, clean water and sanitation, clean energy, decent work and economic growth, registry, innovation and infrastructure, reduce inequalities, sustainable cities, responsible consumption and production, climate action, life below water, life on land, peace and justice and partnerships for the goals which Dr. Kitsri highlighted. What are the elements underpinning the Sustainable Development Goals? The goals will stimulate action over the next 15 years in 5 areas of critical importance. 5 P's. People, to end poverty and hunger. Planet, to protect the planet from degradation, including thorough sustainable consumption and production. Sustainably managing its natural resources. Thirdly, prosperity, to ensure that all human beings can enjoy prosperous and fulfilling life, that economic, social and technological progress occurs in harmony with nature. Fourthly, peace, to foster peaceful, just and inclusive societies. And finally, partnerships, to mobilize the means required to implement the proposed agenda. The 17 Sustainable Development Goals. How are the Sustainable Development Goals different from the Millennium Development Goal? We had the Millennium Development Goals for the last 15 years, and now we have moved on to the SDGs. The 17 Sustainable Development Goals with 169 targets are broader in scope and will go further than the MDGs by addressing the root causes of poverty and the universal need for development that works for people. Building on the success and the momentum of MDGs, the new global goals will cover more ground with ambitions to address inequalities, economic growth, decent jobs, cities and human settlements, industrialization, etc. The new goals are universal and apply to all countries, whereas the MDGs were intended for action in developing countries only. The core feature of the SDGs has been the means of implementation, the mobilization of financial resources, as well as capacity building and transfer of environmentally sound technologies. The new goals recognize that tackling climate change is essential for sustainable development and poverty eradication. SDG 13 aims to promote urgent action to combat climate change and its impact. What are the 10 key factors about sustainable development goals or the global goals? Firstly, the global goals need you. It's not only up to the governments, but it's up to all of us to take action. Even little things can make a big impact. Secondly, the global goals will change the way the world does business. They want to transform the world economy so it works without violating workers' rights and harming the environment. The global goals are one for all and all for one. No goal is more important than the other, and they all complement each other. The global goals will address climate change. Climate change is one of the most pressing issues of our time, and it affects every country on every continent. The global goals will eradicate extreme poverty. The predecessors of the global goals, the MDGs, have helped cut extreme poverty by half from their establishment in 2000 until today. That is a great achievement, but it is not enough. The global goals aim to end poverty in all its forms everywhere by 2030. The global goals will leave no one behind. They are for young and old people, for small and big countries, for people living in rural areas and people in busy cities. They will leave no one behind. The global goals are hands-on. They contain concrete plans on how to change the world, how to pay for it, and how to make sure that everybody is on board. The global goals are global. They tackle challenges for all countries across the globe. The global goals are people's goals. The goals have been developed by all the 193 UN member states, NGOs and people like you, and all working together. Finally, the global goals are the world's ultimate to-do list for the next 15 years. The 17 goals are for making this planet a better place by 2030, which includes ending extreme poverty, fighting inequality, and fixing climate change. Then coming to our theme area, the goal 3, which seeks to ensure health and well-being for all at every stage of life. The goal addresses all major health priorities, including reproductive, maternal and child health, communicable, non-communicable and environmental diseases, universal health coverage, and access for all to safe, effective, quality and affordable medicines and vaccines. It also calls for more research and development, increased health financing, and strengthened capacity of all countries in health risk reduction and management. Now let me take you, how does this health goal, the goal number 3, relates to the other goals? What are the linkages between the health and the other goals? Goal 3, which is promote healthy lives and well-being at all ages for all. There are 6 goals which addresses the risk factors for health. That means they directly affect health, these 6 goals. What are they? Goal number 2, food security and nutrition. It directly affects health. Number 6, water and sanitation directly affects health. Number 7, energy. Promote healthy lives and well-being. Number 11, cities. Number 13, climate change. And number 16, peaceful and inclusive societies. So those are the goals that will have a bearing on health, very closely and directly related to health. Then we have the determinants of health, which have an indirect effect on health, not directly affecting like the previous one. Firstly, poverty. Goal number 1, poverty, is a determinant of health or indirect effect on health. Goal number 4, education. Goal number 5, gender equality. Goal number 8, economic growth and employment. Goal number 9, infrastructure, industrialization and innovation. Goal number 12, consumption and production. 14, ocean, seas, marine resources, and 15, ecosystems. So we have covered 8 plus 6, 14 goals. The next one, number 10, equity, cuts across everything. Cuts across everything. And it has very close linkage with health. And number 17, the means of implementation, which Dr. Kitsuru was highlighting, the partnerships. You see, now you can see health is the center of this, all this business, and all the others are rallied around this and have direct or indirect links with the other goals. So we have 17 goals with 169 targets. One specific health goal, it has 13 targets. The SDG targets are a mixed bag. For example, some are purely aspirational and visionary, will be impossible to achieve by 2030. Some are only useful for some countries, some are only more globally. Many targets providing little guidance for priority setting or accountability. Then the health goal targets, 13 mostly concrete targets includes almost all major health subject areas. Some are complex and include multiple targets within one target. So what is working towards a logic of the targets within the health goal? We have the goal, and to achieve that we have the targets. The health targets are not organized in a logical way, and yet an integrated approach should be central. SDG text on the new agenda on the 26 of the declaration on SDGs provides more clarity. It says, I quote, to promote physical and mental health and well-being and to extend life expectancy of all, for all, we must achieve universal health coverage and access to quality health care. No one must be left behind. We commit to. Thereafter follows a brief summary of health targets. This places UHC, universal health coverage, as the target that underpins and is key to achievement of to all the other health targets. So, if I summarize the Sustainable Development Goal 3 and its target, Goal 3 says ensure healthy lives, promote well-being for all at all ages, and target 3.8 is achieve universal health coverage including financial risk protection, access to quality essential health care services, medicines and vaccine for all. So there are a group of targets. MDG, they are partly the MDG unfinished and expected agenda. They are from the MDG goals. Reduce maternal mortality, end preventable newborn and child deaths, end the epidemic of HIV, TB, malaria and TD, and combat hepatitis, waterborne and other communicable diseases, and 3.7 ensure universal access to sexual and reproductive health care services. Then those are coming from the MDGs. Then we have new targets which have come up in the SDGs. Reduce mortality from NCD. The MDGs didn't talk about NCDs. That was one of the weaknesses. So SDG captured this, reduce mortality from non-communicable diseases and promote mental health. Strengthen prevention and treatment of substance abuse. Our President has quite rightly identified this as a priority problem and giving his fullest cooperation and support in pushing this forward. Strengthen half global deaths and injuries from road traffic accidents. Reduce deaths and illnesses from hazardous chemicals and air, water and soil pollution and contamination. Then we have SDG 3 means of implementation targets. How to put this into practice, into operation. The implementation factors like strengthening implementation of Framework Convention on Tobacco Control. Provide access to medicines and vaccines for all. Support R&D vaccines and medicine for all. Our country has been vigorously working on these areas right now. Increase health financing and health workforce in developing countries and strengthen capacity for early warning, risk reduction and management of health risks. So, this is how it is, the goals, it's converted into targets and then targets and how they have been implemented. So, health linkages with other targets, there are risk factors for health like ending malnutrition, eliminate all forms of violence against women and girls, achieve universal and equitable access, and then we have the determinants of health like eradication of poverty, ensure all boys and girls complete quality primary and secondary education, etc. And then we have the equity and then means of improvement. So you can see the linkages between health and the other goals. What are the health and SDGs potential priority areas for action? What we should do? Firstly, address specific health targets, reproductive, maternal, neonatal and child health, HIV, TB, malaria, hepatitis, NTD, NCD and tobacco, mental health, environmental health risk, etc. and also health system strengthening. Integrated health agenda, right, to achieving universal health coverage, everybody having access to health care. Addressing risks and determinants of health, importance of intersectoral action. We have to work with the other sectors very closely. Health, many countries are now moving this thing on health in all policies. We have to look at the other policies because they have an impact on health. So that has to be promoted, leaving no one behind, and greater focus on equity. And most importantly, monitoring and review the progress. So these are the potential priority areas for action we need to concentrate on. So, as I said, universal health coverage is it's a part of SDGs, and we are trying to achieve the results like global public health security and resilient societies, equitable health outcomes and well-being, inclusive economic growth and employment through achieving the goal of universal health coverage, and that will be achieved by actions looking at through health systems strengthening. As I said, working with the other sectors is very important, the intersectoral action. Address the risk to health or effective linkages with determinants. Build on, expand, work on health in all policies. Examples are NCD risk factors. Leave no one behind. Greater focus on health and related inequalities. Include multiple dimensions of inequality. Centrality of local data within country differences. Although our national averages are good, there are disparities in the districts. Address specific inequality patterns in different health areas and major role for data advocacy and accountability. And then importance of monitoring and review. This has to be done at the country level, regional level and at the global level. And they have proposed targets, specific indicators for goal 3, indicators such as maternal mortality ratio, skilled birth attendance, under 5 mortality rate, NCD mortality, suicide mortality, etc. Concluding, let me say that SDGs are very broad and complex, but health is in a relatively good place with a very comprehensive set of health targets, with multiple linkages to other SDGs as contributor and beneficiary. Even though the alignment with current health priorities is good, reorientation is needed. We need to rethink the universal health coverages as a platform for an integrated approach, intersectoral action, equity, financing and the monitoring framework. What is the way forward? We need to have national consultations, forums like this to discuss this in a very broad approach, useful as a first step. Then focus on the universal health coverage, a unified approach to improving the access to care. Avoid parallel planning processes. We see this happening. Planning in watertight compartments, various sectors. We have to come together, plan together, integrate the SDG into the national planning processes. This is very important. Address the determinants of health by building on real achievements. We have achieved a lot in terms of determinants of health. So we had to address those determinants of health and build on the strengths that we have, leaving no one behind, going beyond the averages. Then partnerships, towards more creative partnerships with NGOs and the private sector, and measurement of progress and results, that is strengthening accountability. So all this will lead us to promoting well-being through sustainable development goals. Thank you very much.